Most women come in to talk about egg freezing because they haven't found the right person to make a family with yet. And it's not, some women are postponing for career reasons, but more likely it's because they want to preserve their chance to fertilize their eggs, their young eggs, with the sperm of Mr. Right, even if they don't meet him till they're 38 or 40 or more or older. And so the thing to remember with egg freezing is that there's a balance between whether you may ever need your eggs versus the chance of those eggs working for you. The younger you are, the more likely your eggs are to achieve a healthy baby when you finally thaw them and use them, whenever that may be. And they can stay frozen indefinitely. So if you freeze them, but if you freeze when you're younger, then, if you freeze when you're 28 and you find somebody when you're 32, you may not have any trouble getting pregnant. Or even if you do have trouble, we still have plenty of treatments that are helpful in the early, that work just fine in the early to mid 30s. So there's actually some interesting cost effectiveness data out there that says that the most cost-effective time to freeze eggs is when you're in your mid to late 30s, like around age 37. It's interesting data because it tells us that you are, the thing is that women in their mid to late 30s are more likely to need their eggs, but those eggs are also less likely to work. It's about once you get to be about 37 and you freeze eggs, the statistics are maybe only 50% of women will get a live birth from a group of eggs that they froze when they were 37. So do you really care about some population-based data, or do you care about what's going to work best for you? And so clinically speaking, we tend to tell people that the best time to really think about it is around age 32, 33, because there's even a significant difference between the chance of a group of eggs when you're 32, 33 achieving a live birth, closer to 70 or even more, 70 to 80% when you're that age. So even if you meet Mr. Right when you're 35 and don't have trouble at 35, then it still has worked out a little bit better for those people who will wind up using the eggs that they freeze at that age.